Hello, and welcome to today's webinar on Getting Candid, the importance of trust in youth substance use prevention. My name is Shamika Davis, and I'm a program manager at the School-Based Health Alliance. The School-Based Health Alliance is a DC-based nonprofit and serves as the national voice for school-based healthcare. Since 1995, the School-Based Health Alliance has supported and advocated for high-quality healthcare in schools. Our focus includes policy, standards, data, and training to support and grow school-based healthcare, particularly school-based health centers. We believe that all children and adolescents deserve to thrive, but too many struggle because they lack equitable access to healthcare service. School-based healthcare is the solution, bringing healthcare to where students already spend the majority of their time in school. When schools, families, students, and the community work together, students win. At the School-Based Health Alliance, we provide technical assistance and training to the school-based healthcare field, and we support the improvement of students' health through school-based healthcare by supporting and creating community and school partnerships. I am happy to introduce our presenters for today from the National Council for Mental Wellbeing. We have Pam Petraszewski and Will Sloyer. Pam Petraszewski is a senior advisor at the National Council for Mental Wellbeing. Since 2011, she has trained more than 8,000 people in motivational interviewing and is a member of the Motivational Interviewing Network of Trainers. Pam is a subject matter expert for the Youth Substance Use Prevention Messaging Guide, where she writes, edits, and presents workshops, tip sheets, and resources for youth serving providers. She is listed in the National Registry of Expert Trainers from the Addiction Technology Transfer Center and has a master's degree in counseling and psychological services from St. Mary's University in Minnesota. Will Sloyer is a project coordinator at the National Council for Mental Wellbeing. He is a licensed social work professional specializing in mental health and substance use disorders with experience coordinating and evaluating training and technical assistance for behavioral health providers in clinical and community settings. Will has worked in the school social work setting, including providing clinical services and case management to children and families. Will holds a master's in social work from Millersville University in Pennsylvania. I am now happy to welcome Pam and Will. Welcome.
Thank you, and thank you for the School-Based Health Alliance for allowing us to talk a bit about this project, and I hope it's of value to those listening. So I want to get us started first by talking a bit about who we are at the National Council. We're a nonprofit membership organization. We've been around since 1969, and we represent more than 3,000 mental health, substance use, and other organizations. We are all about driving policy and social change, and we advocate for equitable access so that there's a greater understanding of mental well-being as a core component of health and comprehensive health care. What we want to provide to you in this webinar is to talk a bit about how we reached out to young people and to providers to learn how the COVID-19 pandemic impacted young people's state of mind and the impact of substance use. From there, we'll talk a bit about ways in which you can leverage and think about the role of trust in the communications that you might be having with young people so that we normalize conversations around substance use. We'll focus in on some specific messages you might use with youth, and some of those are substance specific. And we'll talk a bit about how to use this message guide we've developed and the toolkit that goes with it, which has a number of resources for having substance use prevention conversations. So first off, what I want to have you think about is this way of thinking about our role in talking with young people about substance use. And this comes from the Frameworks Institute. They have this metaphor of, first of all, thinking about substance use as preventable and remediable. And so their metaphor is that if we think about adolescence being like a simmering pot of water, and we think about these social determinants or these other factors that can impact whether that pot of boiling water boils over or stays simmering. Does the young person feel safe in their neighborhood? Is their family experiencing financial challenges? Are there academic concerns, health concerns? There are many things that can raise the heat for a young person. And if you add substance use on top of that, that could make that pot boil over. So we as adults have an obligation to hold the space, to have conversations that feel safe, that feel helpful, so that we can contribute to those conversations being more likely to be preventable and remediable, rather than thinking about adolescent substance use as inevitable or something that can't be shifted or changed. So with that in mind, we sought out to do this project called Getting Candid. And through some funding from the CDC, what we did is wanted to find out what were the effects of the pandemic and those long-term effects on substance use risks and drivers. We focused on substances such as alcohol, opioids, tobacco, cannabis as well. And we approached it by doing some national online assessments that Will is going to talk about in a moment. Also doing some discussion groups. We reached out to a number of young people, and we have a group of youth ambassadors that have been helping us with this project, and also some experts in the field. And as a result, what we'll share with you today is a message guide and toolkit, so that if you're working with young people between the ages of 12 to 18, there should be plenty of resources and ideas for how to have prevention conversations with them.
Alrighty, so this slide is going to provide a helpful overview of the iterative process that our project team engaged in to create our message guide and toolkit that Pam was discussing. So it included surveys and discussion groups. So these national surveys to youth were a good size samples here. So we had 600 to 800 youth in the sample size each time. And as you can see, over the 2 years, there was 4 different national surveys. With the first one in January 2021, and then the last one in October 2022. And so the samples are also weighted by different demographics, age, gender identity, race, ethnicity, region of the country, etc. And we also we did one assessment with 761 youth serving providers from community-based health organizations, government organizations, the school setting. And so we have a really good kind of sample here of information that we use to inform our work and really help to understand the state of youth in our country. You can go to the next slide. So following our surveys and discussion groups, we created this Venn diagram that you're going to see here in a second. And it really shows the disconnect between what you'll see the provider's perception of youth on the left, and then on the right side, what youth actually identified about themselves. So moving forward here, so on the left, we have what providers believed about youth that they thought mattered the most was peers, friends, and fitting in an appearance. And if you think about it, I think there's probably a lot of adults that I would talk to who I can see really thinking that it's not a huge surprise. But actually on the right side, what youth identified mattered the most was family. And even to bring in a more recent example, we were at a conference presenting this information. One of our youth ambassadors shared with us that he wouldn't want to disrespect his family and having a certain personal conversation. And it came as a bit of a surprise to the different folks in the room, because his family maybe said something that was not helpful to this particular youth. But I think that kind of example really shows how youth really value their family more than providers kind of think. And so kind of moving forward into the middle there, so we have some areas of connection with our Venn diagram here with both providers and youth kind of in alignment in their thinking. So a key reason not to use substances is concern about messing up future plans. That's a big kind of message and kind of thing that we can talk to youth about that Pam's going to get to in terms of wanting to have a good and healthy future. And so the most kind of moving forward here, the most effective engagement strategy is in person. That was an area of an alignment there. And then most trusted messengers, both identified parents and guardians. But then on the right side here again, so another area kind of a disconnect that providers didn't quite see coming was that youth actually identified healthcare providers and those who formerly used substances, so those with lived experience of substance use disorder, those perhaps in recovery, those were the folks that youth identified as most trusted in terms of sharing this information about substance use and it being kind of most convincing to them to maybe reconsider things. So we're going to move forward to the next slide. So an important aspect of that last slide kind of leads nicely in here is this aspect of trust and kind of teasing out this difference between trust and comfort when it comes to talking with adults about substance use. And this is from June 2022. And so we have, trust kind of as this, expert knowledge perhaps related to substance use, and then comfort is really this openness and safety to having that conversation with youth. So as you can see here, doctors, nurses, or other healthcare providers were the most trusted source of accurate information about substance use, followed by parents or caregivers. And kind of moving down here, as we can see, parents and caregivers were who youth were most comfortable, that openness again, and safety in having that conversation when speaking with youth about substance use, followed by friends or peers, so those around them, those that are their age. But then interestingly, less than 1 in 10 youth said that they would be most comfortable talking to a healthcare provider. So there's a really significant dip there when it comes to comfort and trust. Okay, kind of continuing on here. So it's also helpful to examine the reasons youth may choose to use substances, and maybe more importantly, the reason they choose not to use substances. So the reason that they choose to use substances there at the top, so some notable themes maybe are, to cope with mental health challenges, depression, anxiety, and some, peer dynamics. Others around them are doing it. 39%, as you can see there, of youth reported that as a reason, and it's fun, though that's on the lower side at 30%. And then, to cope with problems with family, friends, and school, and that's also kind of an overlap too, perhaps, with the mental health concerns. But more importantly, if we go to the bottom here, the reasons that youth choose not to use substances. So I really like this because it's a strengths-based view of looking at substance use among youth, and 32% said that it would be bad for their health, and then 31% said that they want to make healthy choices. So you have that theme of wanting to make healthy choices and of wanting to stay, as a healthy person. That's really something that we can call them when talking to youth and encourage them about. And then 31%, it might mess up their goals and plans for the future. Again, that's a big kind of concept and thing to look at when it comes to talking with youth about substance use. So if we go to the next slide. So youth were asked about how they feel about themselves. And overall, they reported pretty positive self-efficacy, including feeling like they're good people, 77% of youth, and they have a lot to offer. 71% are hopeful about the future. There's that future concept again. And but there's also some, perhaps some negatives too that they reported. And one that we point out is 54% of youth, only 54% of youth, report a genuine sense of belonging at school. And given the COVID-19 pandemic, and people and students and folks in our society being more isolated, that's a major thing right now in all society, right? And so it's not a surprise that youth are reporting that. And 50% of youth also feel like they don't have a lot to contribute. And 68%. Sometimes the pressure I feel at school and at home feels too much to handle. Just know that, especially in some really high achieving academic districts, the pressure to go to college, to get a 4.0, to have it all figured out. And that's not even, counting any other pressures, just endless more, but those are some that come to mind. Like it's pretty stressful for youth. So I think that's what we're seeing there. We go to the next slide. And so one more thing I want to leave you here before I turn it back over to Pam is the knowledge and perceptions of fentanyl. This is another interesting finding to point out. And for those who don't know, fentanyl is a significant contributor to the rise in drug-related overdose deaths in the United States. It's often laced or adulterated, if you will, into the drug supply. And even recently, it's contributed to an uptick in overdose deaths among youth. And so it's something to really be aware of. I mean, I'm sure many watching, who are watching this presentation are probably quite aware of it in their community and just in the United States as a whole. And so we found that a majority of youth are not concerned about alcohol and other drug use in their own lives. But if we continue down here in the presentation, if someone they knew was using drugs, 77% of youth reported that they would be concerned about fentanyl exposure. 77%, that's a really high number. But interestingly, when we go to the next point there that you see, less than 50% of youth report knowing what fentanyl is and report that it would be one of the hardest substances for them to acquire. So that's a significantly lower number than the amount of youth that are concerned about fentanyl exposure with somebody else in their life. And so that kind of begs the question of why is there that discrepancy between those two numbers? And kind of our viewpoint is, our maybe hypothesis here is that youth maybe have heard of fentanyl. They know it's kind of around, it's in the news, it's kind of maybe a buzz sort of term when it comes to substance use and drugs and the drug supply. But they really might not actually know quite as much up to the level they're aware of it, of what fentanyl actually is and the real threats and kind of the facts, if you will, about it. So I think that could be a possible area to help educate youth on, and just given the risk of overdose right now, it's really important. So we wanted to share that with you.
So what we want to do is have you be thinking about what is our role, what is your role as youth serving providers in having these conversations, in feeling that sense of obligation to support young people with the different stressors in their lives. Because what we heard also from the data that we gathered was that 67% of the young people we reached out to said that the pandemic they expected would have a lasting impact on their generation's mental health. So as adults, what can we do? We know that we need to find ways to normalize these conversations so that we can make those connections to what a young person might say is mattering at the moment. School, relationships, connecting it to health or their finances. We also want to think about how we can leverage those regular touch points. So where we have established relationships, where we might be seeing a young person. If you're in the schools and you pass young people in the hall, hey, how's it going today? Keeping those regular contacts intact so that when we have opportunities to bring in conversations that connect substance use to other things that matter to a young person, it can help to create more healthy relationships. And we want to find ways to not only identify risk factors, which we certainly know there are many, but also identify protective factors. Because as you saw when Will was presenting the data, there was a lot of good in that data too. There was a desire for a sense of belonging. There were young people saying, family is important to me. They were also telling us that I feel like I have something to contribute. And so how do we leverage all of those things in our relationships with young people so that we keep the conversation going? What we want to share with you now is a video that we created with some of our youth ambassadors. And we asked them the question, what do you want providers to know? The adults in your life, what would you like them to know about having conversations with you? So please take a listen to this 3-minute video coming right from young people.
You have to tackle what's going deep down with like what teens are experiencing in order to kind of see why they're doing it and how they should overcome it. So in that way, creating a safer space kind of involves just trying to understand where the teens are coming from.
I think that teens, they do want help. They do need support, whether it's with substances, mental health, they do need your help.
I would want the provider to ask me questions and kind of lead the conversation from there, open the teens up and to kind of make them feel that like, oh, okay, this person wants to hear where I'm coming from. This person wants to know what I'm going through.
As for why it's important that I feel like I could approach a provider with concerns in drugs and alcohol, I think it's important to feel like you're talking to someone you can trust.
When students or youth are allowed to verbalize their own fears, their own worries, or their own experiences without worrying about being judged based on a doctor or a guidance counselor, it creates a much more open discussion.
If I were talking to a provider about substance and drug usage, I would want them to kind of relate it back to their own personal experience.
So knowing that the substance use is experienced by regular, normal, loving, passionate people and not just stats on a website can make the conversation resonate more with young people. It definitely often feels like providers are trying to check off the box that they've talked about substance use with their patients, and if they get an answer that's alarming, it's more of a burden that they have to deal with it and less of something that they're enthusiastic about and exploring with their patient.
I appreciate when providers take a step down from their authority and address their role. I may look authoritative, but I want you to know that's not why I'm here. I'm here to listen, help, and guide you.
When looking at youth substance use, it's really important just to understand the why.
Providers can kind of give more information about substance and drug usage to young people by kind of emphasizing the huge impact it has on their future, because I know a lot of people my age, they care about, living a long life, living a healthy life, and also like not affecting the people around them.
To create an engaging and comfortable atmosphere for teens to hear about substance use, meeting face-to-face is best.
I think it's also important for youth serving providers to kind of be up to date with the latest terminology that young people use.
On a personal level, and even with a lot of people that I know around me, we don't really know where to go locally or find these resources just out in our community. I think providers, I think it would be really helpful to just, show that they're there, show that they care.
So straight from some of our young people that we've been involved with. This and many other resources come from our Getting Candid toolkit. And this is just a layout of what it looks like when you go to our main page. There's also a link, and you could scan the QR code if that's of interest. So far, we have up to 35, actually more than 35 resources, and we keep growing them. And a lot of them we run past our young people. We've asked them for input. They've written some blog posts for us. We've developed some tools and resources for providers so that you have worksheets or tip sheets, ideas around social media, which we'll talk a little bit more in a little bit. Language guide. I know that the young people said, we want you to know what you know, and we want you to be able to talk about this comfortably. So how do we talk about this in a way that isn't adding to the stigma? We've got ideas around how to use motivational interviewing as a specific approach to having these conversations. And we'll show you some others in a moment. Some links to some that are some of my favorites, but lots more out there as well. I mentioned risks and protective factors earlier. We developed a worksheet where a young person could look at the lists of protective factors and examples of protective factors so that we keep it strengths-based and not just focused on the risk factors. And maybe they make note of some of the protective factors that are already really solid for them. Maybe they look at the list and say, you know, I wish I had more of this. And maybe with a provider's help, there's some strategizing around how to strengthen certain protective factors. We also have, I mentioned the Language Matters Guide, and then motivational interviewing tips, and many, many more as well. In fact, Will's going to talk about a few more.
Yeah, so we've created some substance fact sheets that you can see here. This is the first item from the toolkit we just wanted to highlight. So these fact sheets include relevant information and current statistics that are relevant to the youth population and to youth-serving providers. They're kind of crafted specifically towards youth rather than kind of the general population. And it just helps provide this accurate and appropriate information for youth because we know in the age of social media and the age of technology and the internet, there's just so much information floating out there. And so we've tried to help youth-serving providers get ahead in this way by providing this accurate information. And so two examples, one would be fentanyl, our fentanyl fact sheet, fentanyl that as I kind of discussed earlier. And then we also have, for example, a fact sheet on hemp products, and given the complexity of the different hemp products and delta THC and just all the different things out there, it's a good thing to look at. So if we go to the next slide, continuing on here, we have our Cannabis Resource Center. And so we've created our Cannabis Resource Center to help provide information, again, specifically around cannabis and marijuana, given this evolving really policy and product landscape that our country has right now. It's just so complicated policy-wise, and as I mentioned in the previous slide, the different products out there and the THC content and what's legal, what's illegal, it's very complicated, and I think it's just something that is new for kind of the world and for youth, and you know, maybe more so than past generations. So we've created this resource specifically. We have state fact sheets, so for 50 states plus Washington, D.C., we have information on policies and usage rates among youth in each of those places, in each of those states. And then other guidance is provided related to specific products, safe usage, medical use, and other policies. And we've also created a 30-minute free self-paced course to walk you through our communication pathway. It includes scenarios, activities, and knowledge checks. And Pam's going to kind of dive deeper into this communication pathway that outlines really a solid process to talk with youth and to address substance use and to build a connection with them based on trust. And that this gives a deeper dive. And the nice thing is it offers a 0.5-hour certificate of completion available. You just have to score an 80% on the post test with unlimited tries. So that could be a nice thing. It's not a continuing ed credit, but it could be a nice thing to present to perhaps your employer or maybe post on LinkedIn, just a nice way to show that you've gotten this extra training and guidance related to talking with youth. So we hope you'll check that out. And so probably one of my favorite parts of this project is our influencer campaign. And so for those who might not know what an influencer is, basically there's this person who has kind of this persona, these sort of activities or just something that they show on social media around a brand or themselves that has a pretty large following. So usually, you know, a couple 100,000 followers for an influencer. And some of these influencers have over 1 million followers. And so we've partnered with these 8 folks that you'll see on the screen, specifically to disseminate mental health and substance use prevention information, you know, directly to youth. Our project is mostly focused on youth-serving providers, as we've outlined. But this campaign was to present information to youth. And the nice thing is that the influencers we work with, we gave them some general guidance for what we were looking for, but they were crafting these videos from their own experience, their own lived experience for some of them, or their own experience as a person of color or as a person from the LGBTQ population and so forth. And our hope is for it to come off really authentic. And so we're excited to share that we've received over 1.3 million views on these videos. And if you want to check them out, you can visit our youth-facing landing page in that link that you'll see below. And we also have some resources that are directly related for youth to read, whereas our website that Pam had showed earlier is more crafted towards these serving providers. But without further ado, I did want to show you an example of one of our TikTok influencer videos. So we're going to pull that up and show it to you.
Have you been struggling and need some help to figure out what to do? I've been sober for over 5 years now, which means I've had to find many alternatives to coping with stress and anxiety because using substances to do so was not working. One of the outlets I found was working out. Yes, there are physical benefits, but the emotional benefits are what matter to me. I'm able to handle my anxiety much more when I'm working out, and that is invaluable to me. After my workouts, I also usually take a little 10 to 15 minute afternoon walk with my coffee, which helps me clear my head midday. While these are just 2 things you can do for your mental health, there are so many others as well. Go to the National Council for Mental Wellbeing's TikTok for more information on the connection between substance use and mental health. Love you!
Yeah, so hopefully you enjoyed that video and it gave you a good sense and insight into what the kind of work those influencers were putting out there. Just a different flavor, to connect with youth and to really view social media and TikTok from a strengths-based perspective of it's not all social media is bad, the common narrative that sometimes we hear, and that we can use it for good and to really connect with youth on their level. So just wanted to share that with you. And we're going to turn it back over to Pam to take a deeper dive into our Getting Candid message guide and communication pathway.
Yeah, thank you. Yeah, and I think one of the lessons we really learned with social media is, how do we reach young people where they are? And, we've done some other things like Twitter Spaces and, thought about Instagram and posting some of our other adult-facing videos on Instagram. And, we know that young people are out using social media, and we heard that they want in-person, face-to-face time with adult serving providers when they really want to talk about some of the hard stuff. So we want to transition now to how you might have these conversations for young people that do want to have more opportunity to explore where they're at. So we're going to go inside the message guide itself. One of the key features of this message guide is what we call our communication pathway. And we created it so that it feels like a fairly simple process for communicating. And certainly within this, there is opportunity to tailor. We know that every young person is their own person. And so adapting this as you see fit is certainly anticipated and welcomed. But what we've got here, and I'll break these down, but we've got 5 levels of how to have these conversations, starting with establishing trust and continuing the intention of ensuring there is trust and rapport throughout the conversation. From there, we want to take it a little deeper and we want to gather some insights and continue to gather insights, meaning not just having a one-way telling a young person what we think they should know, but to ask them questions to find out what is important to them. Because that engagement will help when we get to this other level in orange here, where we do want to have more substance specific conversations, where we're going to frame the communication around what we've learned from the young person, make the case around not using or cutting back or doing other things to ensure protective factors are at play, and then ideally suggesting some kind of next step. What would it look like if this young person were to make a change, were to choose not to use substances, and then really ultimately continuing this as more of a cycle than anything else, where we continue to come back to reestablishing trust, continue to gather insights, and then insert information where it might be useful. So if we were to talk in a little bit more detail about each of these levels, when I think about establishing trust, as an adult, we have to keep in mind that part of this, a big part of this, is being able to be present and kind of declutter. If a young person comes to us and says, hey, can I talk to you for a minute? We have to be ready. And I know there's a lot of things that are in our minds, as it is with young people too. But if I'm going to be really present and I want to show that I'm trustworthy, how do I really stay balanced internally? How do I not allow myself to be distracted by whatever else might be going on and just be present with that young person? And I think with that, it involves having an open mind, staying curious about what it is they might bring to me. Maybe they're telling me something that's actually quite shocking, or maybe it's something that I have some bias about. I need to be aware of those things. And if I show too much of that, I'm going to lose trust. So in this stage of being mindful, I want to give them a voice. I want to be considering what is that developmental stage this person might be in, and what it might be for them in their identity and how that relates to the world around them. I think another important piece of establishing trust is being aware of the importance of putting a pause on any fix I might be wanting to do. So in motivational interviewing, we call this the fixing reflex or the righting reflex. And so as I'm hearing and listening from the young person, what is that tendency I might be having to want to correct them or advise them or lecture them? And it's not so much about wanting and needing to be right. That is less likely to create the trust that I'm trying to get. It's not about winning. It's not about me having a power struggle, but pausing on that long enough to show that I want to hear you out and I want to have that trust in place. Another thought on this stage that I think some people have used is maybe we even ask a question during this point to ask, are you looking for suggestions or do you just want to be heard right now? And I think we'll be surprised at the amount of times that the other person just wants to be heard. Maybe they'll want suggestions at some point, but if they don't know me real well, or we're still trying to figure out trust, it's probably not the right time to put suggestions out there. Along with establishing trust, we want to be gathering some insights. So I want to be asking some open-ended questions. This is where I'm going to demonstrate that curiosity. And maybe it's things like, so what matters most for you right now? And why is that? Or maybe it's just a very open question of what's on your mind. Or what is really important to you right now? For some young people, they are thinking about their longer term future. For others, they need us to just be with them where they are. And it's being very present with, how are you feeling right this minute? Versus what are your plans after graduation? And knowing and getting to know where that young person is why we would ask these kinds of questions. Other example questions, now getting into substances, rather than maybe lecturing them about the state of legalized marijuana, maybe it's an open-ended question of what are your thoughts? Young people often have thoughts and they don't often get asked these things. So allowing them to tell us what they're thinking, how this is affecting them, or maybe this is where we learn about what some of those misconceptions are. Maybe it's a question of how would you avoid drinking if you decided to? This kind of a question is giving them the opportunity to use some critical thinking, to develop some of those protective factors in that they have the opportunity to give some thought to how would I avoid it? Rather than we as the adults saying, don't drink. If you're going to go to that party this weekend, you shouldn't be doing X, Y, Z. But how would you avoid it if you decided to go that route? Another example question might be, what worries you about using someone else's medication? Again, a lot of temptation to say, don't be taking someone else's meds, or, you know, we've got a problem in this school around this particular substance, so you shouldn't be doing it. Let's start from the point of hearing from them and planting the seed with good questions that help them think more thoroughly for themselves about what might be of concern. And then this last one, rather than us having to have all the answers, maybe we turn it around and we say, you know, how would you approach this if a friend came to you? And that's another opportunity to develop those critical thinking skills and allow a young person to be put in the position of, what would I do if someone else wanted my advice? What kind of advice would I want to hear? And then we're working more in partnership with each other. So what do we do with the answers to all of these questions? Ideally, we continue along this theme of still gathering insights by using reflective statements back. So it's another way to help someone be adding to their own insightfulness when they hear themselves a second time through our listening statements. So things like, so it sounds like you're feeling frustrated that your teachers aren't cutting you some slack, right? Rather than taking the teacher's side or, you know, getting too much down any certain road about what was right or wrong about the situation, maybe it's just acknowledging what the feeling seems to be. You're feeling frustrated. Another example might be, I hear that you want whatever it is that they want. You want to be treated like an adult. Whether I agree or not agree with what they've been telling me isn't really the point just yet. The point is to demonstrate, I hear you, what you're feeling is valid, I'm understanding what you're saying, and that continues to deepen the trust so that we could get to perhaps some further partnership in coming up with a plan later. Another example, it sounds like you want an opportunity to show you're responsible. And this might not be the exact words that the person said to me, but if I'm framing it in a way that has strengths-based language and context to it, the idea is that I'm hoping to bring them along into seeing the possible outcome to this. Yeah, I do want to show that I'm responsible. Yeah, I am responsible. You know, this is the only time I've not turned in an assignment. Or, yeah, everybody's treating me like I don't know anything, and I've actually seen a lot more than people know. So those listening statements need to be accurate, and they can be what might not be just said on the surface, but what is below the surface too. So, you know, if you think about adolescence, and a lot of you work in the field because you really enjoy this age group. I'm one of those people. I do think we make a lot of, and there is just in society, a lot of negative assumptions about young people, that they are always taking risks, and, you know, there's a lot of threats, and they don't make good decisions. And sometimes that can lead to us taking over the decision making and wanting to protect, or maybe wanting to coddle. And sometimes those assumptions then can obviously hold young people back. So another way of looking at it or framing it is that what we also know is that this period of time, the brain in a young person is actually looking for maybe positive risk taking. Maybe it isn't all about negative risk taking. How could we leverage that? How could we build on that interest and sense of open-mindedness when it comes to new things? How do we create environments that feel more socially enriching? And that's where I come back to those open-ended questions that allow the young person to contribute to the problem solving, to weigh in on what is their opinion about cannabis, or about what happens if they were to go to a party. So giving young people that opportunity, because it is a time of opportunity, can really help enrich their own thinking. And I come back to, again, some of the Frameworks Institute work, and their CEO, I heard him say once, you know, we really need to reframe adolescence. Rather than seeing it as a time of eye rolling, it is a time of opportunity. And so I think that fresh perspective can go a long way when it comes to delivering these kinds of messages and seeing in ourselves some humility in wanting to have a partnership with the young person. So if we come back to the whole communications pathway, where I've been spending time so far is really in these couple of first stages, because these are the spaces that we want to invest the most time in. There's a group called the Family Advisory Board at the University of Massachusetts Medical School, and they talk a bit about what they call the 80-20 guidance. And what this group says, I think, fits what we're trying to do with this pathway, which is roughly 80–90% of the time, if we can have what they call goodwill conversations, those become investments in the relationship. Those are times where we're not coming in with an agenda, we're staying curious, we're having maybe more lighthearted conversations, get to know you conversations. Those become deposits in a relationship bank. And as much as this project is about substance use prevention and specific messages, I think if we don't invest in these first couple of stages, then those messages aren't going to be heard because the person doesn't feel like they can trust us, or it's going to seem like just one more person telling me what they think I should do. So investing the majority of our time in building trust and gathering insights will make it easier, because there have been more deposits in the bank, if you will, so that we can spend the other time in these kinds of conversations where we might be able to do more productive problem solving. So that said, once we've established some trust and gathered some insights, what we learn that the young person tells us matters to them can then lead us down this framing towards substance use prevention. So when we did these national assessments, we asked about what kinds of things matter most to young people. And what matters is what you see in this listing. For most of the young people, the majority of the young people that we asked, they told us that their future mattered, whether it be, this is the end of the school year, what's my summer going to look like? Or a transition to a different school, high school or college, or a job out of high school, or just the future in general. So we made note of that will be an important message frame for us to come back to if we want to tie them telling us the future is important with preventing and minimizing substance use risks. Other things that young people told us mattered: their health, their physical health, their mental health. So tying messages around the risks of addiction and how that can impact physical or mental health. In fact, more and more as we did assessments in 2021 and then in 2022, mental health continued to be on the increase as far as importance. So young people we know are much more open and wanting to talk about and invest in mental health. The next most common theme that came up in our assessments was what matters is relationships. And it's all kinds of relationships, as you can imagine: friends, teachers, parents, as Will found in our other assessment, mentors. So how can we connect the subject of substance use to impact on relationships? And then the other two were activities, and that could be all kinds of things. It might be a religious affiliation, or a sports activity, or music or art, volunteering. A job might be considered an activity too. And then the last one, also very important, was young people want us to respect their autonomy. They want to be able to make some choices for themselves. I think we all want that. So appreciating that even a young person's going to want that, And so how do we have some messaging that affirms them and themselves? So here's how we took those and created some specific messages. And these were ones that we tested with young people. We tested a whole bunch of them, and these were the ones that came up as young people telling us would be most effective to hear. The first one gets at that theme of the future. And it might be a statement like, don't let drugs and alcohol use, change, or control your plans for the future. Again, with all of these, you may want to tailor them, right? This isn't about just reading something off of a piece of paper. These are more than a bumper sticker. We want these to be used as appropriate, and that might resonate with a young person. The risk of addiction was the second most common source of importance that young person told us. So physical and mental health concerns. So it might be a statement like, drugs and alcohol can change parts of your brain that impact how you think and how you act. And the more you use them, it can be hard to stop, even when you want to. We've got some messages around relationships, activities, and some self-affirming statements as well. I want to point out that in the relationships message frame, it's the statement of there's people in your life who matter. That's what they're telling us. That's a nice reflection. And you're trying hard not to let them down. That part of that message was what middle schoolers said resonated best. High schoolers had a slightly different take. They liked the frame of, and you try hard to make them proud. So high schoolers felt that the positive framing of that would be more helpful than the negative frame of letting them down. Again, every individual is different, so it may be different in your case, but these might be some go-to things to start as you think about them. So after framing the communication, we may want to provide some data or some information. The young people we talked to did say they want some facts. They don't want them to have a lot of judgment in them. They wanted some acknowledgement of harm reduction. So, you wouldn't want to be too heavy-handed with these. None of them told us they wanted a long list of statistics, but it might be that maybe you're having a conversation about vapes. And maybe you might say, we do know that vape companies regularly change up their formulas. And that's a way of getting around regulations and safety testing. What do you think about that? So it's always about coming back to gathering insights. Or maybe you start down the road of making the case and you're not so sure the young person is still feeling like they're in a trusted environment. It's okay and expected that we'll go back and forth in this whole pathway. We've got a statement here about fentanyl, Delta 8 THC, and many, many more. These were just 4 that we wanted to put on the slide, but our full message guide has several that are specific to other substances, others that are more broad, like the first example here. Young people told us they wanted to hear about the experiences of people in recovery. So we have some message frames that might help make the case in terms of how people in recovery have looked back and thought about the impact for themselves. The other point I want to make as far as this step in the pathway about making the case is I encourage you to borrow something from motivational interviewing, which is called the sandwich approach. So when we want to provide information, it can be much more impactful if we use this layered approach where we don't just launch into a diatribe about all of the reasons fentanyl is dangerous, but perhaps we start with a question. Would you be open to hearing more about fentanyl? Or what do you know already? Like Will's data that he showed, a lot of young people aren't very familiar with it, or they might have misinformation. So asking first, what are you already hearing about this? Or what would you most like to know? That might give you a sense of what is most urgent or most prioritized for the young person. This is a way of inviting them into the conversation. because now you can provide information and it's going to be that much more tailored, relatable, because the young person starts the conversation with telling you what they most want to know. And then there's one more layer to the sandwich approach, that after I've provided my statement about fentanyl, I want to come back to the young person and gather more insights. So what do you think? So where do you think you'll go with this information? How does this impact the way you've been thinking about this? This way, it's not so much about me just making the case, it's about us exchanging information. So I'm gathering some insights, I'm providing information based on those insights, and then I'm coming back to ask, what do you think? And that helps give the young person the last word, if you will, or gives them back the driver's seat. It's not just about me knowing all of this stuff. It's about really wanting to know what they think and how this might impact them. We have one more step in our pathway, which is to suggest action, ideally. So these are some of the things young people said, you know, if we were to take a next step, if we were to hear some additional prompts, what would we want to be thinking about? So similarly, you know, you may or may not read this as exactly written, but these were the things young people told us would be most compelling actions to take. We've got some about dealing with stress in other ways, about staying informed and educating themselves. We know that the internet is where a lot of people get information, or through friends or through others. And so being part of that conversation to ask who they might ask or where they might go to get more information. Talking with someone if they're feeling pressured. Maybe they're not sure they want to do too much of a deep dive with us. So opening them up to saying, who else might you feel comfortable talking with? Encouraging them to make their own personal commitment. Talking with friends to encourage them not to use. And some of these, in fact, 3 of them in particular, resonated particularly well with middle school youth. And it's the top left about other ways of dealing with stress, the middle about the personal commitment, and the one on the right about talking with friends. So suggesting some of these, or perhaps putting it out there as what are other ways you could deal with stress, seeing if they could fill in the blanks with their own ideas, or encouraging something that sounds like it might be of use to them. So that is our whole pathway. Again, it is adaptable. We put it together as simply as we could, so it wasn't too complicated. We do encourage people to make it their own, to try some things, see what seems to fit. As we've learned from these youth ambassadors and others, that they do want their voices heard, they do want to have conversations, and they want to find trusted adults to have them with. So I hope this becomes a resource that you can turn to and find helpful. We have a link here if you want to reach out to us to get any more information about these resources or other insights or ideas that you might have. And our email address is gettingcandid@thenationalcouncil.org. Thank you. And I'm going to turn it, I think, back to Shamika.
Yes, thank you, Pam and Will, for a wonderful, wonderful webinar presentation today on getting candid, the importance of trust and youth substance prevention. It is truly, truly appreciated. If you may have any questions following today's webinar, please feel free to contact the School-Based Health Alliance at info@sbhforall.org. And again, thank you to our presenters today from the National Council for Mental Wellbeing. Take care.